Hi everyone, my name is Pavitri.
My name is Anna.
And we're here to talk about Snehadan. Snehadan is built upon 4 components that include competence, care, compassion, and commitment. Snehadan means giving care, and it's located in Bangalore, Karnataka, that's South India. It's a care hospital for people living with HIV/AIDS. And the main services that Snehadan focuses on are medical and nursing care, diagnostic services, spiritual support, inpatient, outpatient, and family care, which is hidden by the motto of Snehadan. So for our scope of work, our contact director, Father Matthew, asked us to build upon the current protocols they are providing to see if the care is actually being implemented or not by the staff in Snehadan. So now Anna's going to talk about the deliverables that we came up with.
Okay, so as Pavitri said, SCT had asked us as the consulting team to come up with a way to measure whether or not their protocols were being met. And so just given the quality improvement mindset that we had going into this, we actually provided much more than they asked, which I will go into a little bit later. But so the deliverables that we have prepared for them are a number of surveys, also a tool to analyze the results from the surveys, as well as a monitoring plan, particularly focused on quality improvement for the future. And so to start off, the first survey that we provided them was an employee survey to give, because Snehadan had actually provided a previous patient survey that was very subjective, and our contact at Snehadan said that it actually didn't really result in much of anything that they could use in order to monitor or improve their quality of service. So what we came up with was this employee survey that is a very objective questionnaire with responses like true or false. Are you providing this detailed list of, from the checklist of protocols they have? And so in addition to the very objective questions that we posed, that we suggested that they pose to their employees, it also gave opportunities for their employees to share any feedback as well. And then the purpose of this survey was to identify any gaps in service delivery that their employees were providing. In addition, there were 2 patient surveys, and so like I said, they had provided one of these previously, and so we recommended that we suggested a much improved version of this patient survey, which was still slightly subjective, asking them their how they felt about the care that they were receiving. But so we tailored this survey to be very brief and focused, as this survey would be presented to the patients at discharge. I apologize. So the employee survey is going to be done either biannually or annually to get a continuous understanding of what employees are providing. And so then the patient survey is going to be describing the whole process from when patients are admitted to the hospital to when they leave. And then there's a third part of the survey that we have also recommended that they provide to their patients for continuum care, so that would be done after their patients are discharged. And we suggested that happens every couple of months after.
And just to add on to that, Snehadan provides holistic care, so we wanted to include everything from admission to discharge and still continue the care after they're being discharged.
And so this is just because, like I said, what they were hoping for, what they asked us to recommend to them was not necessarily quality improvement. We provided them the surveys that they had asked for, but then we wanted to give them a comprehensive package in order not just to know what was being done, but we wanted them to actually be able to use that information and take it, in the future if they ever just decide to improve their quality of services. So We provided a user guide, which is just a basic training of how to administer surveys. And that includes getting consent from the patients, as well as just a protocol of how to
conduct the surveys.
How to conduct a survey. And then we also have recommended that they use this analysis tool that we have provided for them, which is on Excel, which is going to track the number of responses that they get from the patient surveys and employee surveys. And so this is kind of following the plan, do, study, and act cycle, where we're recommending that Snehadan uses these surveys in a way to find the gaps and see what they're missing. So the way that this cycle is worked out, so we recommend that they do the baseline survey to determine what the standard of care is for this hospital, what's actually being done. And so then they're going to administer a patient survey and asking them for their perceptions about the care that they're receiving. And then from these surveys, we're going to be able to tell whether there is a gap between the standard of care that the employees think that they are giving with the care that the patients are receiving. And so then, according to the results from that study, we're going to recommend that they adjust their protocol and their standards of care, so that they can go back and improve what they're already providing.
So an example for that would be, let's say the staff is saying that we're giving them ART medicine, but if the patient's surveys show that they're not receiving any of the ART services, then it's going to show us the gaps between actually receiving the care and if the care is being provided or not. And this is just a further monitoring plan that we came up with. This is not something our director asked us for, but Snehadan has 9 different protocols they focus on, which include team bonding, admission, daily activities, referrals, patient education, discharge, outpatient care, outreach, and end-of-life support. So the surveys are not going to be done right away. It's going to take some time to implement them, get the results, and get them going. But this is something that we came up with to start using something that's already there right away and just find out where the gaps are. For example, it's really hard to read, but one of the activities is providing referrals. So we can monitor if the patients are actually getting the referrals or not, and how many patients are getting them, and then we're going to go and see. Our overall goal is to provide comprehensive care. So by focusing on each activities, it's going to help us see that. It's going to help them monitor that.
So just a broad overview, we provided 3 different surveys, a tool to analyze the results from those surveys, as well as this logic model in order to, if they ever had the resources or wanted to measure any of these particular topics, they can do so in the future. So with that said, any questions?
Yep, you guys are connected. Yeah.
So I was curious, the Excel model that you had mentioned, is that going to be feasible to implement there? Will they be able to, are there people already trained on Excel and know how to use it?
So that's why we had come up with an Excel version where it was, because they do have internet access and computer access.
And that's something that the director directly asked us to do. He wanted us to build an Excel model to continuously monitor the ongoing services.
Okay. Yeah.
Any more questions?
Did you plan, maybe I missed you saying this, did you develop some sort of manual for them to be able to use your adapted PDSA cycle?
Yeah, so we are planning on developing a
a manual so that they're able to take what we're giving them and use it to the fullest extent possible and not have anything lost in translation.
Okay.
Even with the logic model and the process map that we're going to be giving to them, we're going to have an explanation paragraph.
Sorry. That was the end of your 10 minutes.
We have written up a report as well in terms of what each survey is, what the goal of each survey is, how they should go about implementing surveys, so reducing the potential for bias, survey bias, and then, you know, in terms of setting them up for success, what they can do, how they can make improvements based on the survey results.
Okay.
So will the patients be responding to these surveys, or will staff have to, you know, help them out? What's the literacy level? Are they able to?
Well, for the patient surveys, we have a couple recommendations. So part of the problem before the subjectivity was that staff were giving the surveys, which made it much harder to answer honestly for the patients. And there is a high illiteracy level, so we had to consider that. So we recommend either basically having a staff member that has not been directly related to their care. They have volunteers and outreach workers. So basically either having one person designated to administer surveys or someone who has not been directly involved. But we also have this idea, and we're going to write up a little something for a consumer advisory board, or basically like patients who could become trained to administer surveys or to work with other patients. I just think that that could be useful towards sort of empowering patients, involving them in the quality improvement process.
Okay. Any other questions? Thank you.